Welcome to the Biblio Bazaar podcast. In this episode, Dr. Paul and RN Nina take you through the topic of neonatal respiratory distress syndrome. This discussion is proudly sponsored by Nurse Unity Chats, connecting healthcare professionals for meaningful conversations. Let's get started.
Welcome to our podcast. Today, we're diving into the fascinating world of neonatal respiratory distress syndrome. Let's jump right in.
Absolutely. So what's the main issue with respiratory distress syndrome in newborns?
Well, it's a condition mostly seen in premature infants due to insufficient surfactant production.
Yeah.
Without enough surfactant, the tiny air sacs in the lungs, the alveoli, can't stay open.
So the alveoli collapse and the baby can't breathe properly?
Exactly. It's like trying to keep a balloon inflated without enough air. The lungs become stiff, making breathing really hard work for these little ones.
That's tough. What are the main risk factors for developing this syndrome?
Prematurity is the biggest one since surfactant production kicks in around 35 weeks gestation.
Right.
Also, maternal diabetes, perinatal asphyxia, and multiple pregnancies increase the risk.
Maternal diabetes, how does that affect the baby's lungs?
Well, high insulin levels can interfere with surfactant production.
I see.
So babies born to diabetic mothers might not produce enough surfactant at birth.
Got it. What symptoms do these infants show?
They usually present within hours of birth with rapid breathing, nasal flaring, and sometimes a grunting sound during exhalation.
Yeah.
They might also show cyanosis, a bluish tint to the skin.
That sounds serious. How do doctors diagnose it?
Clinical signs are key, but chest x-rays are crucial too. They typically show low lung volumes and a diffuse granular pattern, kind of a ground glass appearance.
Right.
Air bronchograms might also be visible.
Air bronchograms, can you explain that a bit more?
Sure. It's when air-filled bronchi stand out against the collapsed alveoli.
Oh,
It's
okay.
a hallmark of this condition on radiographs.
Interesting. So what's the treatment plan for these babies?
The primary treatment is administering exogenous surfactant directly into the lungs. Supportive care with oxygen therapy is also critical.
Does surfactant therapy make a big difference?
Absolutely. It can dramatically improve lung function. Some babies respond almost immediately.
That's amazing.
It has significantly reduced mortality rates.
Are there any complications we should be aware of?
Yes. There are acute complications like patent ductus arteriosus due to low oxygen levels, pulmonary air leaks, and even pulmonary hemorrhage.
Uh-oh.
Chronic issues can include bronchopulmonary dysplasia.
Bronchopulmonary dysplasia? That's chronic lung disease, right?
Exactly. It results from prolonged ventilation and oxygen therapy, damaging the lung tissue.
Right.
It's a serious long-term concern for these infants.
How about preventive measures? Is there a way to reduce the risk before birth?
Yes. Administering corticosteroids to the mother before preterm delivery can accelerate surfactant production in the fetus.
That's
It's a
helpful.
proactive strategy that's widely used.
But isn't there some debate about the timing of steroid administration?
You're right. Timing is crucial. The steroids are most effective when given 24 to 48 hours before delivery. Too
Okay.
early or too late can reduce their effectiveness.
Makes sense. Are there other conditions that can mimic respiratory distress syndrome?
Definitely. Conditions like transient tachypnea of the newborn, neonatal pneumonia, and pulmonary edema can present similarly. That's why differential diagnosis is important.
For example, transient tachypnea usually shows normal or increased lung volumes, not decreased like in RDS.
Exactly. And the onset and course of symptoms can differ.
Yeah,
Clinical context and imaging findings help distinguish between them.
it's fascinating how radiology plays such a key role here.
It really does. Early and accurate imaging is crucial for diagnosis and guiding treatment.
Absolutely. What about long-term outcomes for these babies?
Many do quite well, especially with early intervention.
That's good.
However, some may develop chronic respiratory issues or developmental delays.
So ongoing monitoring is essential?
Yes, follow-up care is critical to address any emerging issues early on.
Right.
Multidisciplinary support can make a big difference.
Are there any new advancements in treatment on the horizon?
Actually, less invasive methods of surfactant administration, like using a laryngeal mask airway, are being explored.
Oh, interesting.
These could reduce complications associated with intubation.
That's promising. Technology keeps pushing forward.
It sure does. And with continuous research, outcomes will hopefully keep improving.
Agreed. Well, this has been enlightening. Thanks for breaking it down so clearly.
My pleasure. It's always great to shed light on these important topics.
Absolutely. Looking forward to our next discussion.
Same here. Until next time.